Hello, and welcome to another episode of Healthcare Executive Insights Podcast. My name is Mike Sloan. I'll be your host. And today we are thrilled to have Deb Visconi, the president and CEO of Bergen Newbridge Medical Center in Paramus, New Jersey. Deb, thanks so much for being with us.
Well, thank you for having me. It's a true privilege. Thank you.
Excellent, excellent. So tell us a little bit about Newbridge. What do you guys do? What's your area of focus within the healthcare community?
So Bergen Newbridge Medical Center is the largest hospital in the state of New Jersey. We are a publicly owned, privately managed safety net facility, and we are located in Paramus, New Jersey, which is in Bergen County. We have a variety of very unique service lines under our 1 million square foot roof. We specialize in behavioral health and mental health, substance use disorders, long-term care, chronic conditions, and certainly we have been the tip of the spear in the fight against and the mitigation against COVID-19 pandemic over the last 2 years. So, we are here serving our community, and we identify gaps in care that the community may have, and we stand up to support our community in assuring that they get equitable access to quality health care.
It's amazing. I didn't realize, I grew up right down the street from Newbridge. I didn't realize it was the largest hospital in New Jersey, because there are some big hospitals in New Jersey.
Yeah, we have 1,070 beds under one roof.
Wow, wow. That's unbelievable. So how long have you been with Bergen Newbridge?
So Bergen Newbridge was born on October 1st in 2017. I am the first CEO of Bergen Newbridge Medical Center. And when I say it was born is because we took over from previous management of the hospital under a new not-for-profit umbrella in a transformative place for the county of Bergen, creating a true asset for the county with this healthcare facility that the county owns.
Understood. Got it. Makes sense. So you mentioned trying to provide access to healthcare to pockets of individuals and communities that may not have access. Tell me a little bit more about that. How do you even approach that?
Yeah, so we try to think about what is health equity, and what does it mean to us. So for us here, health equity is making sure that individuals in your community, obviously in this case it's New Jerseyans, enjoy a fair and just opportunity to be as healthy as possible. Because when you think about it, we're only as healthy as our least healthy community. So we really embrace that position in our communities to identify those areas and address their health needs in an equitable fashion. We leverage our community health needs assessment, which is a robust months-long process in looking and talking to our community via focus groups and other means to identify what the healthcare needs of our communities are. And we're now in our second community health needs assessment process, and the final product will be unveiled in a month or so before the end of the year. And we rally around that assessment. We don't just put it on a shelf and say we went through the process. We really embrace it, and it becomes the strategic roadmap of the work that we do here at the medical center. It is a board approved process, and again ties into our strategic plan.
So how does that work? So a community health needs assessment, are you looking at individual municipalities or zip codes, or is it get more granular than that and you're identifying pockets of communities that just are underserved in some capacity? How does that work?
Yeah, a little bit of everything. We look at zip codes, we look at municipalities, we look at disease states, what we're seeing as prominent in the community, based on, again, feedback and focus groups and many, many months of interviews and data analytics. So we look at a little bit of everything to be able to plot our course going forward. And because, again, we're a safety net hospital and we are committed to serving the needs of our community, we do focus on our underserved and communities of vulnerability.
Interesting. So how far of a radius do you go with that kind of research? How far would you
Pretty much all of Bergen County we look at.
Okay.
The process is all the hospitals of Bergen County participate in the community health needs assessment, as well as the county of Bergen. And so we look at every town and municipality from the north to the south and east to west. There are some communities that border Bergen County, so we, if there's opportunities there to address some gaps, we certainly stand up and do what we need to do.
Gotcha. So every hospital in Bergen County does these. Is that common throughout New Jersey and the country, or is this kind of a unique thing for Bergen County?
I think it's pretty, community health needs assessment is pretty standard practice to really understand what the needs of your community are, because, as a, major healthcare provider, that's what we're here to do, is, meet those needs, identify the needs, address the needs, and meet the needs.
Right, right. So once you have identified a community that is underserved in one capacity or another, how do you go about addressing it? Is a lot of community outreach? Are you doing events? Is it, digital stuff? What are you doing?
So we do a little bit of everything, as I'm sure you knew I was going to answer. We have a very robust and growing community outreach team. So we partner with the communities that we're talking to. So if it's in Garfield or Bergenfield, we talk to the leaders of influence in those communities to figure out what's the best way to approach those specific communities. So we partner with our faith leaders is another way that we identify those. And we'll either go to a health fair, we'll create our own health fair, we'll create a location where we can set up a practice. We'll put mobile units, mobile vans out into the community. We did a lot of that during the COVID pandemic, where we actually brought testing and vaccinations out into the community with mobile vans and our healthcare teams. So certain communities, that's the way to address them and to get in there. Other communities, will benefit from a telehealth platform or telemedicine platform, where we have also used technology to help us get into those communities. And, we'll deploy iPads, for example, into the community, and individuals can go into our little pod or our mobile unit and actually get a visit with a primary care doctor or specialist right with using a Bergen Newbridge iPad as their way to do that. Because, we do find that not everyone has access to technology. So that's just, again, another way to be able to get in there and, reach those communities that need it so desperately.
Yeah, it's interesting. I've heard this is a common theme, how a lot of health systems have had to adapt during COVID, and whether it's mobile health units or the telemedicine or something that's going to make it more easy for patients to access various providers. It almost seems like it's an overall net benefit for the healthcare industry, in that everybody has been open to different technologies and techniques to reach underserved populations. Do you think that's going to have long-term benefits for those types of communities who maybe were reluctant to come into a health system altogether, or just didn't have a ride, or didn't have, maybe they don't speak English, and they're speaking a foreign language and couldn't figure it out or whatnot?
Oh, I think it's going to have tremendous positive benefits for these communities, because, we'll be able to identify healthcare issues early on. We'll be able to link up individuals with preventive medicine. We'll be able to give them, technology that they can use at home to monitor their health status. So whether it's a scale or a blood pressure machine or pulse oximetry or whatever it may be, we'll be able to identify people with chronic illnesses in particular sooner rather than later. And, there's a trust element here. One of the things we learned early on was that communities of vulnerability, of color, don't always trust hospitals and big health systems. And so having that personal connection, through your communities of faith or through your influential leaders in the communities really has helped us get that trust pact with these communities. They trust us, they know us, our employees speak their languages. If we don't, we have ways to communicate with them using technology. So it really is a part of building that trust that people need to be able to come to us to receive their care.
Sure, sure. So, after this community health needs assessment, you've identified your areas that you want to focus on and the services that they may need. What are the biggest challenges from that step forward? What do you see after that?
You know, getting to everybody. The more that
Yeah.
we're out there and the more that people know of us and what we're doing, the demand keeps growing. And so while it's incredibly gratifying that people are coming forward, it's always, making sure we can get to everybody to address their needs and be out in the community. I think we're going to see a spike in, some chronic conditions. So I think that's going to be important for people to recognize. There's going to be issues with medications, challenges, funding for things, making sure that people have the resources to be able to pay for their medications or, whatever they may need. And other things that we are acutely aware of are the social determinants of health and the impact of social determinants of health on the health and well-being of individuals in our communities. Recognizing that food insecurity, lack of transportation, education access, those are the things that, we take for granted, but those all have a significant impact on the health of our communities. And, what is the role of a hospital or a health system in addressing those? I feel very passionate and committed that we have a role to at least help make those connections and those linkages and make resources available for individuals in our communities that need it. But there's, again, the funding priority. How do hospitals fund those initiatives and still be able to, maintain a fiscal vibrancy so that we can continue to serve our communities?
Right. And when you talk about, perhaps lower socioeconomic demographics, people, large populations with little to no insurance, how can it be sustainable? Are organizations like Newbridge, are you subsidized a lot from the state? Are you going after more affluent areas? How does that work?
We do get some charity care subsidies from the state of New Jersey. Most hospitals that care for these populations get the charity care subsidy, so we do get that. It's certainly not enough to cover the cost. So we try to diversify our portfolio by expanding our services, by taking care of everybody in Bergen County, including those with insurance. So expansion, bringing in more doctors and more programs so that we can help diversify our payer portfolio and expand our services.
Excellent. So what do you see as the future? What does the next 5, 10 years hold for healthcare, not just Bergen County, but on a more macro level?
I believe that hospitals are going to, very much like what we're doing here, learn that care doesn't necessarily have to be delivered in a bricks and mortar, that we're going to be much more prominent as healthcare providers in our communities. I think we're going to see a shrinking of hospitals in our communities. Again, not Bergen County, but in general. I think there's going to be hospitals that aren't going to survive in the future because of the way that funding is. And a lot of hospitals were not able to recover fully post-COVID. So I think there's going to be some shrinking of systems over time. We're going to see a lot more care delivered in the home. We're going to see those that come to hospitals are going to be very sick, much sicker, because, the baby boomers are coming of age. And the more advances that we see in the medical field, the longer we live, which is a great thing. But when we get sick, we're going to need higher levels of acute care in our hospitals. So I think we're going to see a transition there. A full embracing of telemedicine and other virtual ways to reach patients, I think, will still be very prominent as we move forward.
Yeah, it's interesting. I was talking to somebody a few weeks ago, and he was saying just with the advancement of technology, it makes home visits more relevant because you don't have to bring huge, bulky equipment that is only available in health systems, but now they're getting so small and compact that, a doc, a nurse coming to your house can do a lot of really critical tests that could only be done in a hospital in the past. And that's only going to get more and more advanced as time goes on. So
Yeah,
the home visits is interesting.
yeah, and the concept of the hospital at home, that's still under
Mm.
development, and they're still trying to figure out how to pay for it and what it looks like. Some places across the country a little more mature with hospital at home, but I think we're going to see more and more of that as time moves on. We're not going to have a choice, right? We're not going to have a choice. We're going to have to take care of people. I think it's good for communities to be able to get their care, where they're comfortable, where they're at, so they don't have to travel and go places.
Do you guys do a lot of home visits?
We're starting to evolve into that market. We did a lot more during COVID when we were doing vaccines and other types of primary care in the home, but I think we're going to embrace that a lot more than we have.
And going back to what you were saying earlier with equity platforms, what are some I guess advancements in equity platforms? Are there additional ones that you guys are looking into, or how is that going to progress over the next few years?
I think you never know where things will evolve, but I think going into communities, using the virtual platforms, using technology, meeting people where they are some of the equity platforms that I believe are going to, remain a constant for us. Trying to figure out, we partner with a lot of our communities, social services, for
Mm,
example, our homeless shelter. We work very closely with our homeless shelter colleagues to make sure that when people leave our hospital, they have a warm handoff to a place where they're going to stay. And we're linking our healthcare to the shelter. We link our healthcare to the Bergen County Prison, so that we actually
mhm,
provide care to those individuals that are incarcerated.
mm,
When there was the early release program, I guess it was in 2 years ago, because of COVID.
yeah.
Many of these individuals were released without a linkage to primary care or any kind of provider, and some of them needed medication renewals. So we put our people out into the community. We met those individuals where they were. We had an iPad in a mobile unit, and we had them do a telehealth visit with one of our providers who was able to give them medications, and they needed, further specialty care, hook them up with a cardiologist or, an endocrinologist for diabetes. So, we are constantly innovating in ways that we can reach as many people as we can.
Yeah, and I mean, you talk about the incarcerated people and COVID, and I mean, I know you guys do a lot in the mental health space. So, do you see that being a bigger need in some of these communities now than it had in the past?
Mental health and behavioral health issues have become, and I believe it will continue, a huge public health issue for everyone, not just the communities of vulnerability, but we're seeing an exacerbation of these disease states, everywhere across the board, in particular with our children and adolescents. But certainly we've seen a lot more of that over the last couple of years. Now, look, that's a great thing, because that means that people are seeking help. That means that it's no longer a stigma to have a mental health
Mm,
condition. Like, it's
mm,
okay to come and seek help. So I'm actually happy that we're seeing it. We have to be able to um, manage that population and address it in different ways. We're hoping to put mental health providers right into the communities, so that, again, people don't have to travel or wait for an appointment. We're also leveraging technology where people can see their therapists or their counselors via a telemedicine appointment, whether it be a phone or an iPad or computer, just again to try to reach as many people as we can. But it has become a significant public health issue for everyone.
sure, sure. Um, and you mentioned earlier the medication, just keeping costs low and stuff. How do we address that in with the community?
That is definitely a challenge that we struggle with. There is,
Yeah,
you know, there's there are the cost of drugs keep going up, and there really isn't a really great solution.
a
Uh,
light at the end of the tunnel.
there's not. I mean, we're hoping that through some legislative activity, maybe perhaps we can start to curtail the costs of the medications, have better reimbursement through government programs and
Right.
commercial. for drugs, but it's definitely a problem that we're all facing right now. Just the cost.
Yeah. What do we think? The pharmaceutical companies have too many lobbying dollars? Just it's a systemic issue, right?
It is very much so.
Yeah. Well, listen, I that's all the main questions I had for you, Deb. Is there anything else that you would like to share before we call it a day?
No, I mean, I hope it was helpful and informative, and it really was a true pleasure to be on this with you, and really unique
Likewise.
insights that you have. Thank you.
Thank you very much. And we will be. Oh, I wanted to ask you, Deb, if anybody wants to learn more about Newbridge Health Medical Center or about you or anything that you guys have going on. I know you do some public speaking and stuff like that. Is there anything that you would like to let people know about?
Well, our website is www.newbridgehealth.org. Lots of great information there. We always encourage everyone to follow us on all the social media platforms, Facebook, Instagram, Twitter, LinkedIn. We post tons and tons of things about our hospital programs that we do. I'm personally on LinkedIn, and I always, I try to interact with as many colleagues and professionals as I can. So we're open door here. We welcome everyone, and we love to share the work that we do, and we love the support of our community.
That's great. So what we'll do is if we will add a link to your website and your LinkedIn profile when we send this video out.
Perfect. That'll be great.
All right. Deb, well, thank you so much for
Thank
joining
you.
us today.
Oh, thank you for your interest, and I hope to see you again soon.
Likewise. Take care now.